October is Liver Health Awareness Month, and it's a great reminder to take care of one of the body's most vital organs.
Here in Las Vegas, Jubilee Clinical Research is offering free screenings and access to the latest treatment options to help detect and manage liver disease early.
Joining us today is Dr. Elliott Shin, Principal Investigator at Jubilee Clinical Research. Good morning.
Good morning. Thanks for having me.
Pleasure.
It's wonderful to have you in. Dr. Shin, let's kind of start off with the basics here.
Yes.
What exactly is MASLD, or MASH, commonly known as fatty liver disease?
Yes, it's a mouthful. It's a metabolic dysfunction associated liver disease or steatohepatitis, fatty liver disease. Just like the name says, fatty liver disease is a disease where there's too much fat in the liver. So your body doesn't like that, so it tries to get rid of it by causing inflammation in the liver. And if this inflammation goes on for a long time, it causes damage called fibrosis, which simply means stiffening and scarring of the liver, and can lead to cirrhosis eventually. In fact, fatty liver is #1 reason for all liver transplants in America for women, and top 2 along with alcohol liver disease for the general population.
Yeah, you just mentioned it. How is this similar to alcohol-related liver diseases?
The disease process is very similar, but obviously the alcohol has a direct damaging effect, whereas the fat in the liver is more of an indirect effect. But the disease process is the same. Both of them lead to cirrhosis.
Mm-hmm. Yeah, you mentioned this can affect a number of different people, but who's most at risk for developing fatty liver disease?
The people who are at higher risk are people who are obese or overweight, if you have diabetes, or if you have high cholesterol or high blood pressure. And there's some genetic predisposition among the Hispanic population as well. So if you have any one of those, you need to be screened.
Yeah, are there any certain lifestyles or health factors that our viewers at home should be looking out for?
What do you mean by lifestyles?
In terms of, you know, who may be affected? I know you alluded to potentially the Hispanic population,
yes,
people who drink, and other factors. Are there any areas of lifestyles that people lead they should look out for? Are there any indicators as well that people should be mindful of?
So this pretty much everybody, because of the obesity epidemic in America. So everybody has some fatty liver, but if you are overweight, or if you have bad diet, if you're sedentary, which are pretty much all of us, right? So they need to be screened.
Mm-hmm. Yeah. For those who might be concerned, how can they get screened, and what does that process look like?
Yeah, so we make this so easy. We offer free screening at my clinic, offering very cutting-edge diagnostic machine called FibroScan, and it's free. We don't charge anybody. You could just call us. No insurance needed, no doctor referral needed. And if you happen to need treatment, we're the only ones that can really treat this.
Yeah, you're talking about that treatment. What treatments are available to potential clients and patients at Jubilee Clinical Research?
So we have several FDA-approved treatment through our clinical trials. These medications are about 2 or 3 years away from being approved for the general use of the public. And there are different mechanisms among the drugs, but we have some next generation GLP-1 receptor agonist that has an added mechanism of other receptors, so it can not only make you lose weight like the widely popular drugs like Ozempic and Mounjaro, but it also reverses the fibrosis in the liver. Right. So it has an added benefit. And then we have other mechanism as well, with some other ones called FGF21 analogs, which is a naturally occurring hormone in our body that helps to fight the damage.
So really a multitude of options. Thank you so much for joining us this morning. If you'd like to schedule a no-cost liver screening with FibroScan, or learn more about no-cost treatment options, just visit jcrlv.com or call the number on your screen.